In response to recent reduction in foreign aid for key health programs, the federal government has unveiled plans to establish a sustainable framework for self-reliance in financing essential health services across Nigeria. The Minister of Health and Social Welfare, Professor Ali Pate, made the announcement at a workshop on HIV/AIDS, tuberculosis, and malaria in Abuja. Professor Pate noted that the evolving global funding landscape necessitates a shift toward country-led systems and full ownership of health programs to ensure long-term impact and sustainability.
Doing our very best to step up while we ensure that we procure in the right way with an objective long term for us to domestically manufacture some of those items. And the maiden pool that was created by the federal government would be a group purchasing organization. So when you mentioned the health marketplace, essentially we now have a group purchasing organization. So the government uses its buying power to shape the market so that we can be able to buy at lower cost quality products, not necessarily only for ATM, but for many other things. And that's a very strategic change.
Stating that the workshop is a crucial step in charting a course for self-reliance in the health sector, the minister urged state governors to allocate a portion of the additional revenues for recent fiscal gains towards essential health commodities and program costs.
Whatever we can do to ensure that we minimize the adverse impact of those changes, and we are fortunate to have had at least the first 200 billion in the service-wide board with assurance of the others, whatever it takes. And that allocation has been made, and to begin to expand the domestic resources.
Also speaking at the event, the Director General of the National Agency for the Control of AIDS, NACA, Dr. Temitope Ilore, said the meeting was convened to respond proactively to the changes in the international health funding.
To ensure that we guide government policies using our own existing government mandated structures and also facilitating domestic resourcing to ensure that Nigeria, nobody's left behind, but that there's no disruption in services, that we continue to operate, and more importantly, to have a sustainable model different from what has been existing before.
The workshop is expected to identify immediate funding gaps and develop immediate and long-term strategies to reduce Nigeria's reliance on external aid for critical health interventions. CNN News.